Hi, thanks for joining me for this little bonus video. I wanted to try again talking a little bit about leg bone function in the hip socket, or hip function, I guess is the better way to say it. So what we're looking at here is the pelvis. So we've got the front pubic bone here, sitting bones at the bottom. At the front, these would be your hip points, top of your hip, and then at the back we've got sacrum. So this is kind of like the flat part of your low back, just kind of where your waistband would be, and then we've got part of our lumbar spine, and then the pelvic bowl, so front of the spine, and you can see the tailbone. Okay, at the sides of your pelvis are two little inlets, two little circles, and this is where the head of your leg bone goes in. So it's kind of like at the top of your thigh, there's a little ball that fits into the socket and then comes down. So I'm going to show you on me a little bit here. So pelvis is here, and then the leg bone comes into the pelvis, creating the hip joint. And if you were to bring your hands alongside of your hips and kind of just slide your fingers, like you get a press in there, you'll feel kind of like a rounded, kind of bony spot that kind of like sticks out at the very side of your hip. So it's not in your bum, it's not in the front of the hip, it's right on the side. And that's where your leg bone goes into the hip socket. And so if you kind of press your fingers into that rounded spot, and then you start to move your leg forward and back, you can actually feel how it moves. So that's the top of the leg bone moving in your hip socket. I'm just gonna grab a spinal strip here and see if I can give you a little bit more of the visualization. So we've got the pelvis, and then leg bone comes into the hip socket here. And so we can move, keeping the pelvis still. So this is going to be some of our movement exploration later on. We can move the leg bone independent of the pelvis, so flexing and extending. We can also move the leg out to the side and towards the middle, so across the body. We can rotate the leg out, which is external rotation, and you can rotate the leg in towards the center of the body, which is internal rotation. So just keep that in the back of your mind as we go through some of our hip movement this week and in future sessions. So some of the movements, I'll ask you to keep the pelvis still and to move and arrange where it's just the leg. We might also explore movements where the leg stays still, but the pelvis moves on the leg bones. Or it might be a combination of leg moving and pelvis doing something different. So that is what I wanted to share. And if you need some clarification, or if you have any questions, reach out to me by email and I'll do my best to answer your questions. All right, have fun with today's practice, and I'll see you tomorrow.